Thank you, Cancora, and thank you for giving me the opportunity to raise this important issue. Cancora, Cathy Mahon from Lissacullin, County Roscommon, occupies a rehabilitation bed in the National Rehabilitation Hospital in Dunleary that would allow another patient to finally leave hospital. But despite the fact that the 51-year-old has been ready for discharge for the last 6 months, following excellent treatment in Dunleary post a stroke that has left her as a quadriplegic, no home care support has been secured, meaning that she cannot return to her family home. Helen Grace has been trapped in St Vincent's Hospital in Dublin for a year, while she waits for access to the very same bed that Cathy Mahon is in the rehabilitation hospital at present. It effectively means that Cathy Mahon, through no fault of her own, is occupying the only suitable bed that could allow Helen Grace be moved out of hospital. Cathy has spent months in University Hospital in Galway before being transferred to the Mater Hospital in Dublin and later on to the National Rehabilitation Hospital in Dunleary, where she is today. She has been cared for in the only bed in the country which is equipped for a patient who is her level of disability and needs the support of a ventilator to help her to breathe. Ms Mahon has made remarkable progress and was ready to be discharged since May if she received an intensive home care package. However, she is still in the rehabilitation hospital while awaiting that package, which would include skilled home care staff and therapy. Her home is ready. Her husband is keen to have her go home, and her husband has carried out extensive work to the small cottage to accommodate Cathy. Helen, on the other hand, who is also quadriplegic and on a ventilator, has for the last 12 months been occupying a specialised bed in St Vincent's Hospital in Dublin, waiting to be transferred out of St Vincent's to Dunleary as soon as Cathy Mahon can return home. Minister, the Mahons have made absolutely no progress in securing the necessary home care support that they require, so Cathy can leave Dunleary in Dublin and return to Lissacullin in County Roscommon, and by doing so allow Helen to move from St Vincent's Hospital into that specialised bed in Dunleary. Now, I know that there are plans to put a second specialised bed in Dunleary, but it is pointless having a bed there and a patient in that bed that doesn't need that level of care, just because we cannot put the specialist supports in place to allow her to live with as much dignity and independence as she can, and to be able to do that in her own home in Lissacullin, County Roscommon. And I would urge you, Minister, to take on this specific case, to progress this case, to engage with the HSE and ensure that they have the funding made available to them from the national coffers to CHO2 to ensure that Cathy can return back to County Roscommon. Thank you.
Thank you, Deputy Naughton. Minister McGrath.
Cancora, first of all, I want to thank Deputy Dennis Naughton for raising this very important case and these particular cases, and also for giving me the opportunity to outline the position in relation to the provision of home care packages for people with disabilities being discharged from acute hospital settings. I can assure the Deputy of the Government's commitment to providing services and support to people with disabilities, which will empower them to live independent lives, provide greater independence in accessing the service they chose, and enhance their ability to tailor the supports required to meet their needs and plan their lives. The commitment is outlined in the programme for partnership government, and it is guided by two principles: equality of opportunity and improving the quality of life for people with disabilities. In 2020, over €2 billion will be allocated to the HSE Disability Service Programme. That's an increase of 7%, by the way. This will fund the provision of a wide and complex range of services and supports to people with disabilities, including the provision of home support packages. The HSE currently funds the National Rehab Hospital in the region of €29 million annually under Section 38 of the Health Act 2004. Services are provided through a service agreement which is reviewed on an annual basis. There are currently 242 patients awaiting admission to the NRH inpatient services across their brain injury, spinal cord injury, prosthetic amputee and paediatric programmes. Approximately 90% of the referrals are generated in acute hospital setting. There are also a number of delayed transfer of care patients in the spinal programme and in the brain injury programme. Personal assistance and home support services are provided either directly by the HSE or through a range of voluntary service providers to support individuals with a disability to maximise their capacity to live full and independent lives. In 2019, the HSE will deliver 17.9 million home support hours to 53,000 people and intensive home care packages to deliver to approximately 235 people. That's approximately 360,000 hours delivered in the full year. Services are accessed through an application process or through referrals from public health nurses or other community-based staff. Resource allocation is determined by the needs of the individual, compliance with prioritisation criteria and the level of resources available. As with every service, there is a limitless resource available for the provision of home support services, and while the resources available are substantial, they are finite. The number of hours granted is determined by other support services already provided to the person or the family. While the majority of people in receipt of the home care packages are aged 65 or over, approximately 85%, a small portion of target hours are delivered to people with disabilities, which may include those suffering the effects of acquired brain injury. In addition, in 2020, the HSE will be providing new additional resources in terms of providing intensive and service transitional support packages as a positive measure to support people with disabilities. Details of this measure will form part of the National Service Plan to be agreed for 2020, and we are currently working with this. And of course, Deputy, in relation to those particular cases, I will engage with the HSE and CHO to area as well. Thank you,
Minister, I take on board your last comment, and I want to acknowledge that. But with all due respect, Minister, both Helen and Cathy have both been forced to go public. Helen's family have gone public. She's in her 70s and stuck in an inappropriate bed in St Vincent's Hospital in Dublin for the last 12 months. How many more people are in other hospitals across the country waiting to be treated in that hospital bed in St Vincent's? Cathy, who is 51 years of age, a young woman, is stuck inappropriately in Dún Laoghaire for the last 6 months. And you've given the numbers yourself, Minister, the numbers of people around this country that could be treated in that bed, that are waiting for access to that particular bed. Now, I have given your department the details of these two cases. These two cases are in the public domain. And I have to say, Minister, I am disappointed that I haven't got a response in relation to the specific issues that I have raised. Your department looked for specific information from me regarding the individuals. I provided them with that information. And yet, your response here today, with all due respect, Minister, is a generic reply to a generic issue. This is not a generic issue. We have 2 specialist beds in this country being tied up for the last 18 months. We have 2 women being inappropriately accommodated in specialist beds that should not be there. And I have a young woman from County Roscommon who wants to go home. Her husband has carried out changes to their cottage in Lissacull in County Roscommon so she can return home, that she can have her own bit of dignity, as much independence as is possible for her, and to be able to do that in her own home. And I would plead with you, Minister, to take on this issue and come back to me with a detailed reply and a commitment for the funding to unlock these 2 beds for these 2 women and everyone else.
Minister, please, to conclude.
Thank you, Cancorla, and can I also thank the Deputy. And of course I agree that it's not a generic issue, and of course I listened very carefully to those two particular cases. And the answer to one of your questions there was there are 242 patients awaiting admission to the NRH. But can I say as well, in relation to the broader issue, the HSE currently funds the National Rehab Hospital in the region of £29 million annually under Section 38 of the Health Act 2004. And the service are provided through a service agreement which is reviewed on an annual basis. The HSE is committed to protecting the level of personal assistance and home support services available to persons with disabilities. In the 2019 National Service Plan, the HSE priority was to provide 1.63 million hours of personal assistance to more than 2,500 people with a disability, representing an increase of 170,000 hours over the 2018 target of 1.46 million hours. The HSE will also provide the 3.08 million hours of home support to adults and children with disability, an increase of 150,000 hours over the 2018 target of 2.93 million hours. Resource allocation, Cancorla, is determined by the needs of the individual, compliance with the prioritisation criteria and the level of resources available. As in every service, as I said, there is no limitless resource available for the provision of home support services, and while the resources are available are substantial, they are finite. In this context, services are discretionary and the number of hours granted is determined by other support services already provided by the person or family. And there is a need for increased services, and I will take on this issue, and this is acknowledged, and the HSE will continue to work with the agencies to explore various ways of responding to this line in line with the budget available. But of course these are genuine cases and they deserve our support, and I will agree to engage with the HSE and to take on these particular cases, because we all accept that we have to do more in relation to providing services for people with disabilities.